What if you could take a trusted dental implant treatment and make it even better, more precise, more natural, and far less invasive? Imagine restoring all of your teeth in one day with a slimmer, more elegant design, without bone removal, fake gum, or bulky teeth. This is the latest evolution in All-on-4 dental implants. We took what already works and refined it with advanced technology that allows for greater accuracy, a gentler approach, and a more lifelike final result. Not a different idea, but a better version of a trusted one. We call it All-on-4 Next Gen. In the next few minutes, I'll show you how it works and why it could be the right solution for you. I'm Dr David Dunn from Macquarie Street Dental. For more than 25 years, I've helped patients restore their smiles using the latest innovations in cosmetic and implant dentistry. I was also one of the first clinicians in Australia to train under Professor Bronnemann, the inventor and pioneer of modern dental implants. That experience shaped the way I approach full arch treatment today. At our clinic, we offer all forms of full arch treatment, including conventional All-on-4, which has been the gold standard for decades. And today, I'm especially excited to show you this next evolution. But before we explore what's new, here's a quick recap of how the current All-on-4 method works. All-on-4 gives you a set of permanently fixed teeth using a strong, reinforced bridge supported by at least 4 implants in each jaw. It's ideal for people missing most or all of their teeth, denture wearers wanting a more permanent solution, or anyone facing tooth loss from advanced gum disease or dental phobia. All-on-4 restores full arch function, provides immediate temporary teeth, usually requires no bone grafting, and offers a long-term solution for missing teeth. All-on-4 has helped thousands of people restore their smiles. It's reliable, effective, and remains an excellent option for many patients. But like every field of medicine, innovation never stops, and that's where All-on-4 Next Gen comes in. All-on-4 Next Gen is for patients wanting something that feels more natural, less bulky, and easier to live with. It takes everything that already works and elevates it with smarter, cutting-edge technology. This isn't just another implant treatment. It's the new benchmark in full arch restoration that's more seamless, less invasive, and indistinguishable from natural teeth. A lot of patients can struggle with replacement teeth, possibly causing speech issues, food trapping, or a long recovery with traditional All-on-4 treatments. Next Gen was created to solve those exact frustrations. With Next Gen, we ideally replace only the teeth, not the gums. That means no cutting away the bone or gum tissue, and no bulky pink, acrylic, or artificial gum sections. Instead, your new teeth follow your natural gum line for the most natural smile possible. It's thinner and feels closer to real teeth than anything previously available. Think of it like upgrading from 4G to 5G. The same core idea, but with advanced technology behind it to deliver incredible precision, comfort, and aesthetics. So, how does Next Gen actually work? Well, at the Macquarie Street Dental, we've invested in 2 groundbreaking technologies, X-Guide and FastMap, to be one of the first clinics in Australia offering Next Gen treatment. X-Guide is a dynamic 3-dimensional computer navigation system. Think of it like GPS for your smile. It guides implant placement in real time with sub-millimetre accuracy. That means safer surgery, minimal disruption to bone and gums, and highly predictable results. Once the implants are in place, FastMap lets us fine-tune your temporary bridge instantly. The data goes straight to our laboratory and your customised bridge is printed in about an hour or so. After healing, we complete your final bridge. At Macquarie Street Dental, we use the ICE zirconia system, a strong, beautifully lifelike material with no bulky metal framework. This means your new teeth are incredibly durable, feel natural in your mouth, and are built to handle everyday eating without the bulk or heaviness of older designs. Which leads us to comparisons. Conventional All-on-4 has been a life-changing treatment for decades, and it still is. But it does come with a few realities worth understanding. First, we need to remove a portion of bone and gum to create space for the bridge. That's because conventional All-on-4 replaces both the teeth and the gums, and we need room to hide the transition line where the bridge meets your natural gum tissue and below the lip. Secondly, because we're replacing both the gums as well as the teeth, the bridge needs to be bulkier for strength. It still works well, but can feel fuller in the mouth. And thirdly, that transition line I mentioned is obvious and can collect some food underneath it. This isn't a deal breaker, but it's something patients often notice, and it requires more attention with cleaning. This is exactly where the All-on-4 Next Gen changes things. With Next Gen, our goal is to preserve bone and gum tissue. We ideally only replace the teeth so that we can preserve your natural tissue. This usually means faster healing and better long-term options, especially for younger patients. Your new teeth follow your actual gum line, so there's no visible transition line. For most patients, that makes the result look completely natural, and no one would ever know you've replaced your teeth. Plus, no transition line means no food trapping, so it's easier to clean and maintain. And because we're only replacing teeth, the bridge can be slimmer and far less bulky, which improves both comfort and speech, and how it feels when you're eating. Now, while most patients will benefit from Next Gen, there still are some patients who are best suited to the conventional method. Our role is to guide you towards the treatment that gives you the healthiest, most reliable long-term outcome. Naturally, this is the point where people start asking, okay, but what about the pain? What about recovery? Am I even eligible? Let's cover the answers to some of these questions and more. A very common question is it painful? And that concern usually comes from what people have heard about the conventional All-on-4 procedure, where we often need to remove bone and gum to make space for the bridge. Naturally, that can lead to more post-surgery discomfort. With Next Gen, that's different, because we're not removing bone or gum tissue. The procedure is less invasive. We use intravenous sedation and anaesthetic during treatment, so you're comfortable throughout. And afterwards, most patients report surprisingly minimal discomfort. When it comes to recovery, most people take only a matter of days to rest and heal. Your final bridge is then completed 4 to 6 months later, once the implants are fully integrated with the bone and you're fully healed. Am I suitable? As I mentioned before, most patients are excellent candidates for Next Gen, but not everyone. Some cases are still better suited to traditional All-on-4. For example, some patients may have lost considerable bone and soft tissue due to previous trauma or other, which makes them better candidates for the conventional All-on-4 technique. The best way to find out is to come in for a complimentary consult and 3D scan with us. What are the downsides or limitations of Next Gen? There are some limitations. Next Gen may not suit every anatomy, and because it's more personalised and precise, it can be at a higher price point. But long-term comfort and preservation often makes a significant difference. How much does it cost? Price is obviously an important factor, but it varies based on bridge type and your individual clinical needs. At your consultation, we will give you a detailed breakdown of the costs you can expect, as well as information about our payment plans. We will also have a price guide available to download. How long will NextGen last? With appropriate care and maintenance, once your zirconia bridge is inserted, you can anticipate enjoying the results of this treatment over the next 15 to 20 years and beyond. Well, we've covered a lot today, and it's completely normal to still have questions. That's why, ideally, the next step is a complimentary consultation with us. At your consult, you'll receive a full oral health assessment, 3-dimensional radiographic scans, and a personalised treatment plan. You can even see and compare the different bridge materials in person, and you'll be supported by a team with decades of experience in All-on-4 care. After more than 25 years helping patients reclaim their smiles, I can honestly say this is the most advanced full arch treatment we've ever offered. So whether you're ready for the latest innovation or you simply want to explore your options, we'd love to help you take the next step. Book in for your complimentary consultation today. I look forward to meeting with you soon.